Hi, I'm Ingri Boe-Wiegaard from the Acupuncture Center. Today we're doing a video on back pain treatment. So I want to show you how I treat a person with back pain. I have a patient who's willing to be filmed. So come with me to the treatment room and we'll see which point sites we choose. Hi Joe, how are you feeling today?
Very good.
How's your day been so far today?
It's been pretty relaxed.
Okay, good. Now, I treated you a couple days ago, your first treatment for your back pain. How have you been since I treated you?
I am sleeping a lot better. The lower back pain's going away.
Okay, good. Now, your back pain is, if I remember correctly, your back pain was caused by sports activities and working out. Is that about what you think the cause was?
Correct.
I'm going to look at your tongue, and we're going to look a little bit of what's going on inside your body that's causing the back pain, besides what we think is the reason, which is your activity. Let me see your tongue. So you've got a good coating, you've got a good body color, you've got a little edging there, and if you put it a little more, you'll see that it gets red on the tip there. You're basically very healthy, and you will respond very quickly to the acupuncture treatments. So the fact that you've already improved from one treatment is commensurate with what I'm saying. And I think that it'll only be a few treatments we'll be able to do a huge amount of clearing for you. I'm going to check your pulses, which is, there's like 1, 2, 3 positions here, superficially and deep on your artery. And the same thing here, 1, 2, 3, superficial and deep. And as I check these, I'm going to be checking the meridian pathways that I'm going to be treating, especially there's one that I'm going to be interested in clearing for your back pain. But I just want to see, because I think you're very healthy, I think it's going to be in pretty good shape. So we're just double checking that really quickly. And yep, there's a little bit of a blockage there, but that's what we expect when there's a little bit of pain. Can I have you lie down, face down, and we'll do a treatment. You ready for that?
I'm ready.
Okay. I'm using sterile, disposable, prepackaged needles, and they're one-time use, and they're the thinnest and the shortest needles that are on the market. So I don't needle deeply. I'm very gentle, as you remember, and they really don't hurt that much. So do you remember that they hurt very much when I was treating you?
Oh, no.
Okay.
Not at all.
So let's try another treatment here. What I'm going to do here is clear it more superficially up and out. So the upper part of the back is where some of the energy releases that's in this tension that he's got in his muscles here. So it's just, common that people who do sports and work out kind of get a little bit tight, and even though they do think they hydrate enough or they stretch enough, sometimes they don't quite hydrate enough. You see that over the kidneys, or their body just stays a little bit tighter than it should. So these blockages here are really or even up here, are what's causing the lower back to not be able to clear. So we're going to be doing some work on the upper part here. Here's the first treatment's going to be around this point here. Are you ready?
Mm-hmm.
Okay, very gently. I'm just going to place the needle like that. Okay, how was that? That didn't hurt?
No, it's good.
Okay. And then I'm going to put another needle right here. And this is just for the upper back to clear some of this tensive energy up and out. So we're just going to do a couple point sites here, as we can see where he has some extra tension, to clear that. There's reasons for tension up here. It can be that he's working hard and are you working every day? Are you fairly focused at your work?
Yeah, every day.
Is there some stress at work?
A little bit.
Yeah, because that's pretty common, and that kind of activity can keep, a lot of people hold their stress at the top of the body, but I'm going to run down and do a little clearing down. We're going to check out over the adrenals and the kidneys here to make sure he's not too dehydrated. And I have a feeling that you really do drink 4 or 5 bottles of water a day. Is that true?
Yeah, about that.
You're pretty careful about that, because it's really looking really nice, and I can say almost gushy. His muscles are fairly soft here, which means he is well hydrated. Then we come down into the lower back area, and we'll do a couple of point sites down where he really does have his pain. Is it hurting a little bit down into the legs, or is it staying in the lower back?
It's mostly in the back.
Mostly in the back part. Okay, so we'll focus on that. Do just a little bit extra right here at this sacroiliac joint. This is the SI joint here, the sacroiliac joint. And these muscles always tend to be a little bit tight, and they'll chafe on the nerves a little bit, is what causes the discomfort. We're going to leave this alone we're just going to let you lie quiet. Are you comfortable now?
Yeah.
Okay, so this wasn't too painful. And then about 15 minutes, I think we'll leave these needles in for you today, because it's only your second treatment. So it'll be a little bit short, and I did more needles today than I did last time, but that's because I think that you can handle it. You seem comfortable with it. There was no flinching, which is a good sign. So you'll probably clear very quickly for your lower back pain. I anticipate only a few treatments, and so we'll see. So I'll come back in a little bit and take the needles out. So Joe, can I wake you up?
Oh, yes.
Okay, so good, because I know you tend to get a little bit relaxed. Were you falling asleep?
A little bit.
Yeah, the endorphin release in the brain is part of what gives you that relaxation. Plus lying down, of course, is very nice. Now I'm going to gently take the needles out and close the point sites a little bit with my finger here. Just close the point sites gently. Just to indicate that we want them to be closed now, not be open releasing anymore. And then what I want you to do is do 3 showers per day just to help clear the energy. The electrical charge will discharge to the wetness. So take 3 showers a day if you have time to help clear more of your tension. Okay, so that's something you can do besides just drinking water. You can use a shower as well. So the water is your friend internally as well as externally. So that'll be how you're doing. So now when you're ready, you can get up and then we'll talk some more. Thank you, Joe.
Thank you.